Hi, my name is Lucy Murphy. I am one of the Victorian myeloma specialist nurses, and I also have the pleasure of facilitating an online Partners and Carers support group once a month. Today, I will be presenting on a carer's toolkit. The goal of this toolkit is to understand the role of a carer and the different types of carer support that they can provide, but also the importance of seeking support for you as a carer and caring for someone who is living with myeloma. If anything today provokes any feelings or questions that need clarifying, please contact one of the nurses at Myeloma Australia. The role of a carer looks different to each individual. It may be helping out for a few hours, or it might be your full-time carer position. It might be paid or unpaid. We are going to go through some of the different roles of a carer. However, it is not limited to the following. We have listed some of the common and frequently challenging roles and responsibilities some of our carers take on. So, practical support. It might be finding a way to get your loved one to their appointment through transport. It might be attending the appointments and helping to understand the information that's given. It also might be managing medications or assisting with everyday living activities like preparing meals or house chores. A role of a carer also includes advocating for your loved one. So, learning a complex disease and the medical jargon that comes along with it can be extremely overwhelming, as well as also understanding the blood tests and the diagnostic procedures. This then allows you to be able to advocate for the person living with myeloma and their needs and wants. Another role of a carer is taking on the emotional support. Due to the nature of myeloma, it can be extremely emotionally exhausting. As we know, it is currently an incurable disease. As well as seeing your loved one experience it, it can be seen as an emotional roller coaster. Sometimes it can be fast and sometimes it can be slow. And carers often take a lot of this on. We often see this ongoing support as carers fatigue. The impact on carers. So, caring for someone with myeloma can be deeply meaningful. However, we acknowledge that partners and carers typically take on a lot without even thinking about it. These might look like a physical burden, so driving to the appointments, increased house chores, assisting with your loved one with mobility, and sometimes even hygiene care. It might even lead to you neglecting your own physical needs or appointments and self care. The The emotional impact may look like stress, fatigue, and the added stress of possible changes to work and finances, feelings of being overwhelmed, frustration with the healthcare system. You may even have the constant exhausting thoughts of, are they okay? Are they in pain? Is the myeloma responding to the treatment? What is the what is the next blood test going to show? Again, the emotional fatigue that is seen due to the nature of the disease. Some people may feel grief for the life they thought they would have at this stage with their family member or friend. Partners and carers can often feel guilt of needing a break, or it might be feeling like they are not doing enough. There's also the social impact. So, this might be affecting relationships and social life. So, the constant relaying of updates, health updates to family members and friends can be exhausting and time consuming. Relationship dynamics can change, and this often is seen with new cancer diagnoses. This may be intimacy or even communication. Social life may be limited due to your loved one being immunocompromised and immunocompromised, so minimizing exposure to other people. And then social life can be impacted due to the emotional and physical burdens, giving you less time to refill your own cup with catch ups and hobbies. You might find that you are more irritable and emotionally detached or lacking motivation. These might be signs that you have carers burnout. I want to highlight to you all that carers burnout is not a failure, but a sign you need further support. We will speak more about the support in the upcoming slides. Informed decision making. So, what does it mean? So, it means to understand the available options, the possible benefits and risks, and choosing what best aligns with a person's values, goals, and quality of life. Myeloma is often a long-term, relapsing condition, and treatment decisions may need to be made at multiple points along the way. So, how can I help as a carer? So, attending the appointments and taking notes of key information, help clarify what was said and ask further questions. Support the person to express their preferences and their concerns. Advocating for their goals is key. If decisions are feeling overwhelming, you can seek further support and speak about your options. It is okay to ask for more time and clarification. Ask for it to be explained in a different way. Know you can always seek a second opinion, and it is okay to change decisions over time. To help with informed decision making, you can contact one of your specialist myeloma nurses and book in a support line call through our website. Practical and financial support. So, caring for someone who lives with myeloma can often bring unexpected practical and financial challenges. Knowing what support is around can help with preventing of carers' burnout. Practical support people can help with transport to appointments, medication management, household tasks, meal prep, and managing paperwork, as well as some other activities. Financial support to consider are things like carers payment or carers allowance, work flexibility. So, speaking to your employer regarding sick leave, carers leave, or potentially flexible work arrangements. There are things like PATS, which is the Patient Assisted Transport Scheme, or concessions that might be available to you through your medications or transport. The type of support may need to change over time. A social work referral through the treatment hospital can help you navigate some of this paperwork and the different services out there. I highly recommend that you accept any help that is offered. So, self-care for carers. Caring for someone with myeloma, as we have spoken about, can be extremely physically and emotionally demanding. Over time, carers may put their own needs last, often without realizing it. To self-care, it is to protect your own capacity to care. We spoke about some of the common signs leading to carers burnout to be able to identify and seek support. These again are the constant tiredness, feeling emotionally drained, irritable, difficulty concentrating, and neglecting your own health and feeling isolated. Again, when they're not just limited to these symptoms. Self-care does not need to be expensive or time-consuming. It might be 10 minutes of protected time to prioritize your own needs. This may look like regular meals and hydration, talking to someone you trust, refinding your hobbies that bring you feelings of calmness and joy. Emotional self-care. What does that mean? It means acknowledging your feelings, seek emotional support, if that is through support groups or helplines. Remember, you are allowed to have your own needs and goals too. Instead of completing the exhausting task of messaging multiple people with the health updates, we recommend creating a private online group to send out updates to the people that you need to. Letting others help. Accept the help when it is offered and delegate where possible. Reach out for professional help gives you that protected time to prioritize yourself and can help give you the tools on how you can show up for yourself and your loved one living with myeloma. Communication advocacy. Communication is key from both sides, the treating team and the person receiving the care. You have to be able to communicate. Being a carer, advocacy may be part of your role. If your loved one is not feeling well due to the disease or side effects, it is important that you are speaking up for that person's needs. When there are delays, confusion, or conflicting information, you can sometimes be that person to help clarify that information. Advocacy also means that the person receiving the care, they have their autonomy and people are respecting their choices. Planning for the future together. So when do we start planning? It's any time. At diagnosis, major treatment changes, during relapse or progression, or just when support needs are increased. You can always revisit and change your plans. Planning for the future together is paramount as it can help reduce anxiety around change. ensure wishes and goals are clear, ensuring support is accessed as early as needed, and create trust and shared decision making. Good planning means recording and understanding personal values, culture, and family needs, what brings meaning, comfort, and dignity. It might be the balance between treatment with side effects and quality of life. Planning for the future and documenting this protects choice and gains clarity for the future. Planning itself is an act of care. Navigating the different resources can be overwhelming. We have listed some of the most accessible resources. So, Advanced Care Planning Australia helps people record values, treatment preferences, and future care wishes. State Health Advanced Care Directives. So, each state has its own form and processes. Hospitals and GPs can help with these. Carers Gateway is an Australian wide website. It looks at emotional support, practical advice, counselling, and respite option services. The other resource is Centrelink, which is a service which is part of Services Australia. This looks at carers' payment and allowance and related supports. On the right, you can see previous recordings if you wish to watch more of our online carers resources on our website. Again, if you are needing support to access these resources, please reach out to your local hospital for a social work referral, your GP, or speak to a specialist myeloma nurse at Myeloma Australia to help you navigate this. To summarise today's Carers Toolkit, your role and support is a pivotal part of someone living with myeloma. We would like to acknowledge the impact on carers as they experience their loved one's myeloma journey. And finally, planning for the future can reduce stress and uncertainty. And as we mentioned, planning can be ever changing. So thank you for being a pivotal part of the myeloma community.